So I'm here today with Dr. Jen Bickel, a member of the Neurology Today editorial board, and we're going to talk about the current state of how neurologists are doing through this pandemic. You know, as we've discussed in our issues and as we've discussed in our recent editorial, it's okay that neurologists may not feel like they're all right. But what I wanted to do is speak to Dr. Bickel because she has an understanding about how we can acknowledge and perhaps work on each other's wellness. So first of all, Jen, thanks so much for joining me today. And what do you think have been some of the major sort of fallouts on neurology and the neurology community, you know, from the pandemic we've been dealing with for the past year?
Yeah. So Joe, I mean, even just that statement, what over the past year, right? So I think that that was something that when this all began, nobody was really quite prepared for, not only what we would face in the medical community, but also what would be going on larger within our country, within the systems, and with so many other problems that have come up. Our community has been affected in a wide variety of ways, right? So first of all, just medically speaking, we're seeing a new disease process that we have to learn how to take care of, that we see all different manifestations of it, right? I'm in pediatrics, and it's a whole different manifestations than what you see in the adult world. But then there's also these, many of our people in the community have had job insecurity, right? Or alterations in their jobs. And there's, countless amounts of neurologists who have been called into the first line, into the front line to deal with COVID in roles that are not as a neurologist, right? How many of us anticipated that over the past year that our expertise would not be in neurology, but as a general doctor, right? And then there's also just the isolation, right? So people are not able to be around each other as much. Typically, if you had a rough day, you could find somebody maybe to go have a happy hour with, or maybe we'd see each other at conferences, or maybe we could travel a little bit more. The sense of community, while it's transferred online in a lot of different ways, I'm not sure that we all understood just how much strength we constantly get from each other and our social interactions.
Yeah, I think that cannot be overstated enough, the importance of community. And, you know, while we try to maintain a sense of community in this virtual world, the community of a neurologist includes not only their colleagues, but at least for me, it's also our patients, right? Just that community, you walk in, you see the waiting room is filled with a hubbub of activity, you know, family members come in, you know, meeting people, sort of having an opportunity to sort of speak to them about their concerns. And I think through COVID, even for those people that have come into the office, everything is very like sterile and for lack of a better word, clinical, right? Everybody's wearing their PPE, only the patients coming in. They're only there for exactly what they need to be there for. They're in, they're out, you know, and I think it's definitely something that a lot of us have sort of noticed. So what are some strategies perhaps that we can use to, you know, maintain a sense of community and perhaps try to rebuild a sense of community through this difficult time?
Yeah. You know, that's a great point. You know, so what can we actually do? It's interesting because one of the things that I often think about is the fact that we typically have a tendency to share meals together when we try to celebrate, right? But we can't do that as much, right? There's not the potlucks, there's not the coming and ordering food and everybody kind of sitting down and eating together. So what are the ways that we can, I think that we need to be more intentional about the way that we show our gratitudes to each other, right? So we used to allow those moments to happen sort of more sporadically, right? Or spontaneously, I guess I should say. And they happened because the opportunity for human interaction was so much more frequent. But now I think that we have to be incredibly intentional about reaching out to our colleagues, right? We normally wouldn't send an email to someone just to say, how are you? Because we would see them in the hallway more, or like you said, we'd have time to talk with them. So that intentionality of connection, checking in on people, as well as showing gratitude for what they're doing is incredibly important.
And I think that's really important, especially, you know, with the risk of people feeling sort of isolated a little bit.
Yeah.
You know, I think, as you said earlier, COVID has changed the way we not only practice, like you said, people are now practicing in roles that they really haven't formally trained for, but even in ways that they have trained for, meaning even when we practice what we know how to practice well, which is neurology, the setting has changed completely, right? A lot more telemedicine, a lot more people working out of their basements, trying to see patients on video screens all day. And so I think that that sense of isolation, people can really develop it. What would you advise to a neurologist who, might start feeling isolated, disconnected, disengaged? What are some of the strategies, perhaps, that they can use individually or personally to, to feel like they're less disengaged? Because I think that's a big concern, at least among some of our community and private practice neurologists, right?
Mm-hmm. No, I mean, and I think that one of the things that I just think of in general is that assume the people around you are not doing okay. And I'm not trying to be a fear monger, right? But I'm trying to say that so many people are struggling that we should assume that those around us are not doing okay and that they need help. And so for someone who does feel like they need help and that they're not doing okay, the very first thing one of the things that the people that I talk to in my role at work is a lot of times people feel alone in feeling that way, right? They think that other people have adapted perhaps better than they are, or maybe that they're weak and this shouldn't be bothering them anymore. That's probably one of the common things that I'm hearing the most of, is that I should have adapted better by now. I should be over this by now. I should be grateful for what I have, right? And in reality, there's this judgment that people are doing about how they're feeling that is a barrier to often reaching out. And so I think that if we can even preemptively just start realizing that nobody is doing awesome right now, right? A lot of people are struggling in a lot of ways. And I think that it's our responsibility to not wait until there's a crisis, either within ourselves or within our colleagues, in order to be aware of what resources we have available to us, right? It should not be the first time that I look up what our psych services that my hospital offers. Shouldn't be after I'm talking to somebody in crisis. It should be something that, let's say that, I would challenge the viewers that even after you finish this video, or heck, right now, even while I'm talking, go ahead and look it up just to become familiar with that. Because again, if we go to the promise that nobody's doing awesome, then that means that either yourself or someone that you care very much about is going to need to know how to access those resources.
As we sort of come past this, and we enter whatever the new normal is supposed to be, which I don't think anybody knows, right? What comes next? How do we go back to, where we were before, or do we? Is it a whole new process?
I think the first thing is really that we have to let go of the anticipation of going back. There has never been a time in human existence that we ever go back, right? It's always changing moving forward, right? So of course, some of the things that we used to do are going to come back, right? But if we think that there's going to be this time where 6 months enough people are vaccinated and now it returns to what it is, that's just not likely to happen. And moving forward, one of my concerns, to be very honest, is that I'm afraid of how many people think they should be done with it. Right. When we're moving forward, right? I'm afraid by the amount of people who are going to think, oh, well, that trauma, that was in May of 2020 and now it's 2022. And so I don't even care about that anymore, right? That there has been significant amount of trauma experienced by so many people over this past year, many of the people not having time to adequately deal with it, that in the future, I do think that that's going to be an issue. And again, kind of going back to what you were talking about before, is the more that we can normalize that is going to be okay, the more that we can normalize that there's not some switch that happened where the world is back to normal and now we just pretend that this weight, this burden, this everything that this past year has been didn't leave some sort of a mark. I think that we're going to have to see organizations really, one of the things is that a lot of times our hospital organizations and everything have kind of done general human resources supports for doctors and nurses and healthcare workers. And I think we're going to have to see much more attention sort of put on what I call that space between where the patients affect us and we affect our patients, right? That space of well-being, not just the space of well-being as I guess you could say that any human being would need, but specific supports for people who have been in this crisis and are taking care of some of the most sickest patients without all the resources that they need.